Good evening and thanks for joining us. We begin with news about the new coronavirus outbreak. The World Health Organization has now declared it an international public health emergency. It's concerned countries with weak healthcare systems may not be able to cope. The WHO stressed 99% of cases are in China, and it praised that country's response. The numbers, though, keep rising. Chinese authorities are reporting more than 9,400 confirmed cases worldwide. The vast majority are in China, and there are thousands more suspected cases. Every province in mainland China now has confirmed cases. On this map, the darker the red, the higher the number. Wuhan, the capital of Hubei province, where this outbreak began, has the most, over 1,000 cases. 213 people have now died from this new strain of coronavirus. All of them are in China. And the WHO says China, which has put millions of people under quarantine and is rapidly building new hospitals to handle all the sick people, has set a new standard for outbreak response.
I have never seen in my life this kind of mobilization, the measures they are taking, which I believe will reverse the tide. But not only what they're doing is protecting their people, but I know from the figures also, you know that it's protecting the rest of the world.
There are more than 100 confirmed cases outside mainland China, scattered across at least 19 countries and territories. India has confirmed its first case, and so has the Philippines. Canada's health minister says the risk here remains low, and declaring a global health emergency does not change that. The government is still working on a plan to airlift Canadians out of Wuhan, the center of the outbreak. We'll get to that in just a moment, but we begin with Redmond Shannon on the WHO declaration and what it means.
This was the World Health Organization's third emergency meeting on the coronavirus outbreak. And on this occasion, after hours of debate, the panel voted to declare a global health emergency.
The main reason for this declaration is not because of what is happening in China, but because of what is happening in other countries.
The head of the WHO repeatedly praised China's response to the outbreak, saying it can turn the tide.
It's actually doing more than China is required to. This is to protect especially countries with weaker health systems.
Labelling this a global health emergency means more international resources for prevention and more help in finding a vaccine. But it doesn't mean restricting travel for now.
WHO doesn't recommend and actually opposes any restrictions for travel and trade or other measures against China.
Regardless of the decision, concern about the virus has already spread globally. Air France is among the growing list of airlines suspending